talking to Sydney Graham. Now you are it's called a patient engagement educator. What is that?
It's a very unique position. What I do is I am here to educate the general public on health benefits in the hospital. So normally I teach medical students, nurses, interns, the healthcare professionals on how to better deliver care as the patient and families are equal partners in the care team. So our typical system is very physician-centric. Everything is revolving around the needs of the physician. And the model of healthcare is really transforming to be the patient experience-centric model. So it's vital to understand what the needs of the patient are, what the needs are of the family. That's what's key to the delivery.
So what's the parents' needs and what's the person's going in the hospital needs?
Well, it's important because if you're talking pediatric with children, they don't have a voice. And I have a son who's been through a 20-year journey. I am the expert on my son, on my family member. The physician is the expert on the condition. So if you combine your expertise and work collaboratively together, that provides better delivery care for the child.
And how is that translated?
That's a great question. When that translates, he's got a better journey, less anxiety for the patient, less anxiety for the family member. They heal better, they heal faster, they're out of the bed sooner.
Now, how is that? Why? What's the logistics?
Well, because a lot of the problems in the hospital system is because you're terrified of what's going on. Anxiety levels are huge. We all have fears. We need to be well educated on looking after our family and loved one within the hospital so that we're empowered to take them home and look after them in the home setting. So they need to be an equal partner in the care in hospital in order to move forward and do that at home as well.
Now I understand. Okay, so are you allowed to go in the operating room area with your child?
Well, that's a really great example. So I don't go in while the operation is happening, but what I have done in the past, and which some hospitals do provide, they don't tell you they provide that, you need to know to ask for it, and it's a wonderful program, is going in while your family member is being anesthetized. So when my son was young, he would fall asleep in my arms, calm, quiet, with no anxiety.
Because he's with mom.
That's right, and that translates into low anxiety for me, who is the caregiver looking after my son. I leave him in perfectly capable hands of the caregivers, but then when he wakes up in recovery, the first person he sees is mom. He goes back to sleep.
Because he knows he's
recovers,
secured.
and he's comfortable and confident because mom's right there beside him. It aids in his recovery. And then if you have to bring a family member back again and again and again, it's been a very positive, good journey the first time in order to have that happen again and again.
Okay, so is there any age where this is really important?
I think it's every age. It really is a big model of care in the pediatrics, and that's where it started. But I don't see much different in having my child in there as opposed to having my mother in there, or a husband, any loved one. They're not listening to what's going on so much. They need someone there to assist them. They need an expert that knows them well and can help them through their journey.
So let me ask you this, Sydney. If the parent doesn't need to go into the operating room, how is it that you collaborate with the physicians? Tell me more about that process.
Everybody has a very different comfort level and how much participation that they want to have within the hospital system. So what I teach the physicians is what the family journey is like and how what they do affects us so that they understand it from the other side. It opens up their eyes. They see what our needs are, and it's a win-win for both the families and the physicians. So if the physicians are understanding, they've got patient engagement, it's only helping them do what they do.
Okay, patient engagement.
Particularly the nurses. If you're in hospital, I can be there to assist with a lot of the smaller things that the nurses do, enabling them to go look after patients that really require their help. So respect me. I have the knowledge of my son. I know him better than you do. I can be there for a lot of safety issues as well to recognize when something is really going wrong that
respect me. I know him, so listen to me, and then you can work
Right,
with me better.
please hear me, because you have to trust that I know what's going on.
Yeah.
I want to be part of his care. For me, it's essential that I am 100% a part of his care. That's what I need to get through our family journey, is to be a part of that. So work with me. This is not about doing to the patients, and it's not about doing for the patients. They're not coming up with the ideas and doing for us. They need to do with us. Equal partnerships. Empower yourself. It's really feeling confident to ask for what you need in the hospital, knowing that there's a lot more opportunities that are possible that you may not have been told about. But I need to look after him in the hospital, because I have to take him home and look after him there. And it's important that I know what I'm doing.
How long have you been doing this?
Oh, 20 years ago he was born, so I started right away. Lots of intensive training through Canada and the States, and working with hospitals and teaching physicians and healthcare providers over 17 years.
Well,
A long time.
okay, more information, because I do care, and I'm sure other people do care as much as you and I. Your contact info
I do.
for
If
those
you
that
wanna-
care is
Yes, if you want to contact me for any assistance, my email address is Sydney, SYDNEY.C2 and C @rogers.com.
thank you so much for caring.
Thank you.